afternoon, everyone.
Bonjour tout le monde. Merci d'être avec nous aujourd'hui. Je m'appelle Kina Leclerc et je serai l'animatrice. Avant de commencer, un petit
Place your
rappel
phone
de
on mute
placer
until I invite you to speak or to ask your question. And please do not place your call on hold. Available for questions from the media, we have, disponible pour répondre aux questions des médias, nous accueillons Mayor le maire Jim Watson, Steve Canelacos, City Manager, Directeur municipal, Wendy Stevenson, Chief Financial Officer, Chef des Finances, and Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur Général des Services de Protection et d'Urgence. Phoning in today, we have la Docteure Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique, Dan Chénier, General Manager, Cultural and Facility Services, Directeur général des loisirs, de la culture et des installations, Donna Gray, General Manager, Community and Social Services, Directrice générale des services sociaux et communautaires, Stephen Willis, General Manager, Planning, Infrastructure and Economic Development, Directeur général de la planification de l'infrastructure et du développement économique, John Manconi, General Manager, Transportation Services, Directeur général des services du transport en commun, and Kevin Wiley, General Manager, Public Works and Environmental Services, Directeur général des services des travaux publics et des services environnementaux. On the line, we also have Rick O'Connor, City Clerk, Greffier Municipal, and Valerie Turner, General Manager, Innovative Client Services, Directrice générale des services novateurs pour la clientèle. I will now invite each agency alphabetically to ask their question. You may ask one question and one follow-up. Par ordre alphabétique, j'invite maintenant chaque organisme à poser une question et une question de suivi. We'll now start with Alex Gouge at 1310 News.
Hello, this question is for Mayor Watson. Given the 3% proposed tax increase, how do you think that would impact people who are struggling financially amid the pandemic?
Well, thank you, Alex, for the question. As you know, we made a commitment several years ago to keep the tax rate at a certain level so it would be predictable for those members of the community who budget their household budgets, so that it didn't have these wide gaps of going up, 4 or 5%. So we recognize that any increase is a hardship, but this is also providing very important basic services, whether it's public health, paramedic, police, fire, and so on, that have come under incredible stress and strain as a result of COVID-19. So what we've tried to do is find that balance between making sure Ottawa remains an affordable city and providing those good services that the public have come to expect. There's always a great debate at budget time. There will be people that want a tax cut, a tax freeze. They want the rate to go up to provide even more services. And I think what we've tried to find, and I believe we've been successful in the last 10 budgets that I've had the honor of being involved with, is that medium where we respect the hardworking taxpayers of the city who pay the bills around here, but we also ensure that those services are good value for money. And they are particularly needed in this crisis that we're dealing with right now with COVID-19. Thank you.
Thank you. And for my follow-up, just for Mayor Watson, and if anyone else wants to chime in, that's great too. For the $15 million earmarked for 250 new affordable housing units, could you just explain a bit more about that in terms of specific location, or if it's too soon to say?
Yeah, we don't know at this point. It goes into the housing budget, and in some instances, for instance, it could go to our housing authority, Ottawa Community Housing, to build new units, or it could go to one of our housing partners like CCOC or Nepean Housing or other not-for-profit housing like Multi-Faith Housing Initiative. So that will be worked out once the budget is approved. There's a process in place that would probably most likely be an RFP where one of those or more of those groups would apply for funding, and they would take responsibility to build. In other instances, it also, there's funds available for upgrades of facilities. A number of our units at Ottawa Community Housing are older, energy inefficient, and it would require, for instance, new weather stripping and proper windows and doors to bring their energy costs down. So there's a number of different, as you know, this is the largest number of dollars that we've ever spent or invested in housing in the City of Ottawa's history. And that's thanks in large part to Council's decision to increase the budget by another $15 million this year, in addition to the federal and provincial governments coming to the table with significant new dollars. For instance, the $30+ million that Minister Hussein announced a week or so ago for modular housing, or for us to potentially buy a hotel to take it over for more permanent housing for those people who are looking for a home. Thank you.
Thank you so much for your time.
Thank you, Alex. Who do we have from CBC Ottawa?
It's Joanne Kinello. Hi, everyone. Thanks very much. My first question is for the mayor and city manager, please, gentlemen. We all know the cities are not allowed to run budgets. You could be facing $153 million budget if the pandemic continues. Can you talk a little bit about where that shortfall would have come from, and your confidence in the levels of government, and Mr. Kanellakis, what that contingency budget might look like if all that money doesn't come through? I know that's a number of questions, but I would hope that I'm just looking for you both to expand a bit more on the possible shortfall for 2021. Thank you.
Yes, thank you, Joanne. I'll ask Wendy to comment specifically in terms of the breakdown. Obviously, we're in the same boat as 443 other municipalities that have seen significant increases to our operating costs as a result of COVID-19, and a significant decrease in our revenue for things like transit and obviously recreation programs. Certainly the discussions I've had with the Premier and federal and provincial cabinet ministers, they have indicated that they understand that while they've been great partners in phase 1 for 2020 and making us whole, and we still have a small piece to make up on that, they also recognize that the virus is not going to magically disappear on January 1st, nor will our ridership go up magically on January 1st. So one of the recognitions that I feel optimistic about is on the transit funding. That funding doesn't end on December 31st of this year. It goes for the first 3 months of the fiscal year into 2021, which they recognize that they're going to have to be there for the long haul. So I'll ask Wendy to comment on the specific breakdown. Thank you.
Yeah, thank you very much, Mr. Mayor, and good afternoon, Joanne. The large majority of the pressures for next year relate to transit. I believe it's approximately $72.9 million, and that has to do with the reduction in ridership and the loss of revenues. And then there's the enhanced cleaning services that we have to provide in terms of safe and secure services to our residents. The next piece is really around staffing in all of our facilities, ensuring that we have appropriate levels of staffing to be able to deal with the pandemic, speaking to our long-term care centers, ensuring that we have our shelters appropriately physically distanced across the city to be able to continue those services into the new year. We also need a significant amount of personal and protective equipment across the organization in delivery of our services. There was a slide in the presentation, and I'm happy to share it with you after, Joanne, that gives a complete breakdown for each of the departments that shows the pressures. And just to the mayor's point, in terms of the amount that we're projecting, it's $153.5 million, and it's really dependent on what happens next year, how long we're in this for. So that number could be smaller if things progress better in the city. And then we have a mitigation plan that stands behind that in terms of being able to backstop it. So as the mayor said, we're having conversations with senior levels of government seeking some funding, and we have a plan in place should that not come through.
En français, Monsieur le maire, quels sont vos est-ce que
Do you really hope that this deficit will be absorbed, or?
Certainement pour moi et les autres municipalités dans la province de l'Ontario, c'est vraiment important.
Yes, certainly. It's very important to continue to work in partnership with the federal government, the provincial government. We are very happy with their support to our budget for this year. We have to look for some $60 million more, but we are applying for this at the province. And when I talked to Premier Ford and Prime Minister Trudeau, they said that it's necessary to continue to support municipalities after December 31st because no one knows when the virus will go away. So we need to maintain that very positive partnership with the other levels of government.
Merci beaucoup. Moving on, we will go to Ted Raymond at CTV.
Hang on, I didn't get a follow-up.
Sorry about that, Joanne.
No problem. I'm happy for the answers to come up in French. My question is for Dr. Vera Etches. Is the doctor's on the line?
Yes, I am. Thank you.
Hi, Dr. Etches. Dr. Etches, the provincial plan that came out yesterday has a number of epidemiologists concerned because the restrictive measures don't come back into force until the positivity rate is 10% or 100 cases per 100,000 residents a week. Are you supportive of the parameters that the provincial government has put around the color-coded system?
I think my answer is going to be that it's more complex than that, what we need to do right now. So let me try to explain. The threshold currently there for red is definitely higher than what I will need to use to let people in Ottawa know that we need to strengthen our actions to prevent COVID transmission. So in that regard, I think it's a very high bar for needing to make sure we do all we can to slow down COVID transmission before we hit that threshold. And so I think the complexity comes in that I am supportive of businesses being open. I think that it fits with looking at the significant harms to the health of our population that are happening because of unemployment, because of people's inability to draw on the supports that they usually would have. So I'm very supportive of the direction to open things. What I want to see is that we take care as much as possible, both within the businesses that are open and then individually. We need to strengthen our mask using. Use. We need to make sure that we are sticking to our households when it comes to close contact, unless we're single and we need other social supports. So that kind of caution needs to be in place now. It needs to be underlined as we open that we're doing it carefully, and I will have to talk to the community if I see the percent positivity going up, the rates going up, certainly before we hit those thresholds.
Well, just to be clear, just to clarify, then you might bring in measures before we hit the numbers that the province put out yesterday for their red code, which seems a little bit different than ours.
Well, my first step is always to inform the people of Ottawa if we're heading in the wrong direction, like I did at the end of September and early October, before the provincial restrictions came in. I told people, we're in a bad place right now. The rise is too rapid, and people responded. And so this is what I expect we may have to do again. That if cases are going up too rapidly, I'll let people in Ottawa know. Let's focus. Let's do the measures that work. Stay home when you're sick. Wear your mask indoors. 2 meters distancing. People have done it before. They have turned the curve, and we need to be alert to when we're heading in the wrong direction.
All right, thank you very much.
Just too confusing. It's not crystal clear.
Thank you, Joanne.
Yes,
we will now go to Ted Raymond at CTV Ottawa.
Hello, thank you. My first question is for the mayor. Given the expected drop in revenues that you're expecting next year and the deficit you're facing, do you feel this budget is a bit too reliant on tax revenue to fund services, as well as hinging on that government funding that you're hoping for to kind of cover the deficit?
Sorry, Tay, can you repeat that? It got cut off a little bit.
Oh, sorry. So, is this budget too reliant on tax revenue to fund services, given the drop in revenues that you're expecting from transit, recreation, things like that? And do you feel maybe a bit too reliant on the government coming through for additional funding?
Well, primarily it's those two big sources, other government contributions and property taxes that do make up the bulk of our budget. We have fees and fines and admission charges to pools and so on. So this really highlights the straitjacket municipalities are in. We do not have a lot of revenue tools at our disposal. The very fact that we have to rely on property taxes to fund things like social services shows there's that inequity in the system. So we're not going to change that now. I had the honor of being a municipal affairs minister, where we did upload a number of services such as Ontario Drug Plan and excuse me, the Ontario Disability Support Program, Ontario Works, and prisoner transportation from the provincial courthouse. But that was some time ago, and we benefit to the tune of about $121 million as a result of those uploads. But our primary revenue sources are, as I described, and the property tax is a relatively stable number, and in fact it goes up every year. Our assessment growth is estimated to go up 1.5%. We were a little uncertain about that, Wendy, at first, but it's come in, we believe, solidly at 1.5, which means people are building houses, and those people who move into those homes pay property taxes. So we couldn't do what we're doing now in terms of all of the extra work as a result of COVID-19 if we didn't have that other support from the Premier and the Prime Minister's governments, because obviously we're talking hundreds of millions of dollars that are required to provide an increased level of service and to offset the revenue loss from things like recreation programs and transit. Thank you.
Okay, and as a follow-up to that, and maybe Mr. Kanellakis can jump in on this, you say that you do have contingency plans just in case government funding doesn't come through. Maybe you could describe a little bit more about where changes to the budget might be necessary if that comes to pass, and also maybe when we can expect to know a little bit more about what this contingency plan looks like.
Thank you for that. When we first got into this, we started looking ahead, and we realized that we're going to be into 2021, or a good part of it anyways, and as we were building the budget, we knew that we can't be certain that the entire gap will be funded by the levels of government. And we have assurances, as the mayor said, that it will be, but we had to start looking at it from a risk basis on what things could the city do to cover the gap in the budget for 2021. And so we started, looking at the things that we could do within our own steam without impacting services. The last thing we prioritized as the top priority was not to reduce our services. So obviously we're going to look at capital projects. We're obviously going to look at our reserves. And eventually, if we're pushed there, we may have to get to service cuts. But that's probably the most difficult choice council's going to have to make, because if you look at our range of services, that choice is really tough when you're still in response mode. And the example I use to the staff that work here is it's like being in the middle of the flood we had last year in West Carleton and saying, I'm going to cut back the staff and pull them out of the flood zone because we have a budget shortfall. And we're in a response mode right now. Our social services are stretched to the max. We've got hundreds of people working over there, public health. We've moved all kinds of people and hired almost 1,000 people to support them. Our paramedics are going crazy. Bylaws had over 11,000 calls extra just in the last seven months that they're dealing with. You look at public works, we're still picking up garbage. Garbage has actually increased because people are home. We're still got to maintain water, sewers, our roads. Winter's coming. building. So when you start our development permits, you saw our building permits, the mayor talked today, we had a significant increase in the same time period year over year in terms of what's happening with construction and infrastructure. Our own projects are going. So when you start looking at the range of city services, it's going to be very tough to make those calls. So we said that for a first, what can we do on our own, because we see these as one-time costs. The Treasurer's been very clear that at some point we come out of this and we start regaining our revenues, we start gaining transit riders at some point. What can we do to deal with a sort of a one-time crisis with one-time costs, with one-time funding sources to get us through there until things start coming back. But the whole thing's going to be dependent on what range of funding we get and how big is the gap, and that will determine then at what level of severity we have to go on the mitigation measures.
Thank you very much. Moving on, we will go to Craig Lord at Global News.
Thanks very much. This would be for Mayor Watson. One of the things you talked a lot about in your remarks was the LRT and the significance of it long-term for Ottawa, but we've also heard that we're not sure when ridership will increase on Ottawa Transit. So if ridership does not increase in the years ahead, is there a point at which you would feel comfortable maybe putting off future phases of LRT or doing new studies on the feasibility of LRT out to places like Barrhaven and Canada in the long term?
Yeah, thank you, Craig, for the question. Look, there's lots of doom and gloom predictions that ridership won't go back to pre-COVID levels. We saw the same thing when we had the longest strike in the city's history many years ago. People thought, oh, it's the end of their time on transit because they bought a car because of the strike and so on. The numbers went down, and they went down significantly, but they came back up over a number of years. So we're very much in the long game when it comes to transit, simply because it is a massive project that costs significant amounts of money. And phase 2 construction is going very well, and we want to get farther east to Trim Road, we want to get farther south to the airport and Riverside South, and we want to get farther west to Algonquin and Moody. So that project is underway, and there's nothing really that's going to stop that. We have to continue that to make the first phase work even better. And as you know, we just completed the environmental assessment for Barrhaven, and we did Canada-Stittsville a year or so ago. So those projects are down many years down the road because at this point we don't have it in our fiscal framework to fund that without the federal and provincial governments. But while there's no question transit is had the biggest hit in terms of revenue loss, that's the same with every transit system, by the way, in Canada, if not the world. We have to continue planning for the future because we're a city of 1 million. We'll soon be a city of 1.2 million, and we're going to need transit. So the predictions of, no one's going to go downtown because some companies have decided to allow their employees to work from home, you'll still see massive amounts of people coming into the downtown core, whether it's to work, whether it's to go shopping, whether it's to go sightseeing. And we have to be prepared for those large jumps in numbers of people living in Ottawa and visiting Ottawa. And transit, mass transit like LRT is the way to go. And I'm very confident that we will get the cooperation of the federal and provincial governments for the Barrhaven, Stittsville and Canada legs of the project, for the simple reason those are our fastest growing areas in the city, and they too deserve equal access to good transit to bring them from their community into the downtown core or farther east or farther west or south. Thank you.
Just as a follow-up to that, you mentioned the Barrhaven EA getting approved earlier this week. There are potential impacts to about 120 rental homes there, and Councillor Eglai is establishing a working group to help mitigate the impacts on those residents. Just curious if the mayor's office will be involved in that working group in any way, and any other general comments you might have on the potential displacement of residents in the Median neighborhoods there.
Yeah, I appreciate the work that Councillor Eglai, as the ward councillor, has done, and the fact that his resolution, I believe, at committee passed unanimously, and I indicated to him that anything I can do and my office can do to help in that cause, we will be there. This is, as you know, many, many years down the road, so it gives us enough time to plan properly. And if the decision is taken to assist these individuals and the families there to ensure that they get better accommodation at a reasonable price, we are in the housing business, as you know, and if we can be of some help to make sure that the decision is, once a decision is made, that we help these individuals, because it's obviously a very disturbing situation to find that your house may be demolished, but our staff reviewed all of the different options in terms of making sure that we got LRT into the fast-growing Barrhaven town centre, and Councillor Eglai is a good ward councillor, and he will work to ensure that those individuals who are going to be potentially displaced are assisted in every way possible. Thank you.
Thank you, Craig. Nous allons maintenant passer à Julien Paquet.
Julien Paquet from Le Droit. Hello. Hello, Mr. Mayor. I'd like to pick up on the question of the possible deficit for 2021 if the pandemic continues for several months to come. My question is the following. What do you intend to do to actually restore a balanced budget? You mentioned earlier that we depend greatly on assistance from the province. Are there any other parts to your plan? What can the city do? What is it planning to do really to cut specific spending, for example, to deal with this deficit situation? Thanks, Julien, for your question. Our priority is to persuade the two other levels of government to work together to come up with the money, because as a municipality, we're not in a position to come up with $150 million to cover a COVID-19 related deficit. So I've kicked off discussions with them. The other mayors of the other municipalities of the country are doing the same with their governments, their provincial governments. We're trying to convince the Trudeau and Ford governments that their levels of government have to work with us on this. As Mr. Kanalakis and Ms. Stephenson said a few moments ago, we have a plan B. A plan B would be a freeze, for example, on hiring. We would cut travel costs, hospitality costs, things like that, to make up the deficit. But I'm really focusing my work on reaching out to the other levels of government. We're in the same situation as any other mayor across the province of Ontario. No municipality has the capacity to pick up the tab for COVID-19. It's impossible for us to do that at the municipal level. This is why I'm working with the province and the feds. I'm an optimistic by nature. I've been talking to politicians and public servants across the province and federally as well. They know that it's important for them to be generous with us. And as Ms. Stevenson said this morning, the first step, the first stage has been very, very positive. We're talking about $124 million here. We're now applying for a further $60 million for this year. And we'll continue talking to elected officials at all levels to get their support. Thank you. Thank you. My follow-up questions are following. I don't know if Mr. McConey's on the line. Mr. Manconi's on the line. Now, the increase in OC Transpo rates is lower, in fact, than what it was planned to be last year. And then, of course, there have been lots of issues with the LRT as well. You have to take those into account. So why are you increasing rates this year again? Well, we'll be talking about this at the transit committee. We'll be answering questions on that at the committee, and then we'll be talking to journalists afterwards. Thank you.
Thank you very much. Merci.
Thanks, Julien.
Willing at Ottawa Citizen.
Thanks, Kina. First question, I think it might be for Wendy. It's regarding user fees. I just got the copy of the budget book now, so I'm just going through them. It looks like the average user fee increase is higher than what we've seen in previous years. I'm seeing, for example, arena rentals are in, I think, the 4.5% increase range, and swimming lessons are up in the same ballpark. So maybe you can explain a little bit about the philosophy going into creating the user fees and what the challenges are there.
Thank you very much, John, for your question. The approach that we take in terms of building the user fee schedules really aligns with the fiscal framework, and the majority of the fees that you see should reflect inflationary increases. So if there's something that's above that, then the cost of providing that service has gone up, and they're ensuring that we're actually recovering the cost of delivering that service. So there's some slight nuances that you will see throughout the budget book, but the majority of the fees will be increasing at inflation.
Okay, thank you. Just a follow-up, Wendy, I wonder if you could just talk to us quickly about, you haven't been CFO for not even a year yet, and here you are in 2020 having to quarterback a financial response to a major public health situation. So maybe you can just talk to us briefly about what that experience has been like.
It's a great question, John. It's actually been an incredible experience. I would suggest when the former Treasurer Marion handed off the baton late last December, nothing of this magnitude was ever, foreseen in the future. Certainly not something that I would suggest we discussed during our handoff either. But as I said, the experience has been incredible. It's been really great in the sense that it's been an opportunity to really, I'm going to say, take a very, very deep dive in so many areas across the city, to have that broad understanding of our finances, but also our programs and how we support our residents across the city, and coming up with some very, I'm going to say, innovative solutions to be able to deal with the financial pressures that we're facing. And it's very much the same as we approach our 2021 budget. The budget was, when it's tabled and contemplated, it's really something that we haven't faced previously. So quite a challenge, but very enjoyable at the same time.
If I could just offer a comment on that, I think Wendy is too modest, as is Steve, but both have done a remarkable job. If you notice, John, the level of cooperation with the Police Service Board, Board of Public Health, library, our outside agencies, there's been a lot of good work done behind the scenes to get us to this document. And in addition to all of the usual pressures that we have as a city year in, year out, there's the added and compounded pressure of COVID-19. So we're very fortunate. We had a great treasurer in Marion. We have a great treasurer with Wendy, and I think Steve and his team have done a remarkable job with this document in times that we've never, ever experienced in our lifetime. I've never seen anything like COVID-19, obviously, the tragedy and the challenge that it faced, that public bodies in particular face, and the private sector, with restaurant closings and shops boarding up and so on. So this is, I call this budget both prudent and responsible. It's prudent because we're trying to live within our means and recognize that people are strapped for finances, and responsible that we have to continue to provide those services that people count on at the best of times, and even more so during a pandemic. Thank you.
Thank you both.
Thank you very much. Nous allons maintenant passer à Jérôme.
Jérôme Bergeron from Radio-Canada.
Oui, bonjour, monsieur.
Hello, Mr. Mayor. First of all, I'd like to ask you the following question. Tomorrow is Budget Day in Ontario. What are your expectations about the budget process? Well, it's a good question. I'll be watching this closely. Our priorities here at the City of Ottawa continue to be Monday for public transit infrastructure, affordable housing, and of course funding for public health. I was talking to Minister Elliott 2 days ago, and I was telling her that the province has to continue to assist the public health office here in Ottawa, because as you heard during the council meeting, Dr. Etches and Councillor Eglai have both said that some programs cannot continue because we're really focusing all our resources on dealing with the coronavirus. So that's something that I hope that there will be new money for public health, not just for the City of Ottawa, but for all public health departments across the province. Thank you. Follow-up question now. OC Transpo. The losses are in the millions on a weekly basis. Why are you not cutting routes? Because you know that people are not coming back downtown anytime soon. Well, I think this is a question you should perhaps ask of Mr. Manconi. John, are you on the line? Yes, Mr. Mayor. We're not cutting routes because it's important for everything that Ms. Etches has just spoken about. We have to make sure that we can provide for social distancing on public transit, on the public transit system. If we cut routes, we're undermining those who really depend on the public transit system, people working in the hospitals, healthcare workers, restaurant workers. It's also part of our economic recovery plan. Businesses like restaurants, worker-based or worker-driven businesses really require public transit services. If we change our schedule significantly, that could be problematic for them. It would increase pressure on those people who depend on public transit. We'll be dealing with this at the next meeting as well when we talk to the budget. Thank you very much.
Sure. Obviously, our standard requests of continued support for infrastructure, affordable housing, and transit continue to be priorities, but of particular interest this year, above and beyond the financial assistance to the municipality, is the specific financial need of our public health unit and that of every public health unit in the province. They're under tremendous pressure and strain, and as you know, Joanne, they haven't been able to provide a number of their basic services, such as the dental care program, and they're really stretched in terms of resources for the Healthy Babies program, because all resources, or almost all resources, are going in to fight and combat COVID-19. So I certainly raised this issue with Minister Elliott a few days ago, and we undertook that we would talk along with Councillor Eglai and the Minister and myself sometime next week or the week after, because we recognize that public health has extraordinary financial pressures put on them, and while we are there to help backstop them in the short term, we very much need the province's support for public health, not just in Ottawa, but every public health unit in the province is going through the same fiscal challenge. Thank you.
Merci beaucoup. Thank you very much. We will now go to Pat Ugocioni at Your Community Voice.
Yes, my question is for the mayor. You say you're confident that the province will come forth with funding to make the city whole in 2021 as well. But on the public transit side, do you think enough is being done to trim costs rather than just waiting for the province to bail out? I mean, there's examples all over, social media of buses running empty all over the city. Do you think something else needs to be done in OC Transport rather than just taking the bailout check to cut back on expenses there?
Yeah, I'll ask, John responded to that just a moment ago, Pat, in French, so I'll ask him to repeat it in English. But we actually are, as you know, if you think back a few months ago, our projected deficit was about 192 million, I think, Wendy, and that has come down now to about 181. So we actually have been tightening our belt in terms of a discretionary hiring freeze and discretionary spending freeze. So that number has gone from 192 to 181. We actually have been reducing costs. But on transit, John, do you want to just repeat your comments with respect to social distancing and so on, and the need for transit during this time?
Yes, thank you, Mr. Mayor. Hi, Pat. So Ottawa's been different than other jurisdictions. We've heard of others laying off and so forth, and I can tell you that you only have to scan the media to look at the challenges that's causing on their recovery plans, and there's overcrowding reports in other jurisdictions in Canada. And again, we've been out there leading. We're the first to implement masks. We're the first to implement rear door boarding. And, we're the first to work hand in hand with our public health officials. And our social distancing piece is working really well with, yes, we have, at a certain point in time on a given route, you'll see what is referred to as an empty bus. But we also have had situations where people have asked for additional service because of crowding. And so it's that right balance. And we'll be talking in detail about the pros and cons of cuts in terms of budget strategies and what we're doing to mitigate that, because as the city manager has said, we're not just sitting and waiting for bailout checks. We've got other mitigation strategies. We are saving money. We're watching the bottom line very carefully. And we also have strategies as to how do we make sure that council doesn't handcuff itself and limit its ability to maneuver. So we'll have additional details later on at the Transit Commission, Pat. So if you're there, happy to answer questions after that media also.
Thanks. My second question, I think, should be for Dan Chenier, but maybe Steve Kanalakos. At some point early on in the pandemic, several thousand city employees were laid off. I don't know if that's the right word, but what is the status of them? Were they brought back and then let go again at the second wave? Just wondering what the status of those employees are.
Hi, Pat. Yes, you're correct. They were placed on declared emergency leave sometime in April of this year. Some of them were gradually brought back for spring and then summer camps and for some fall programming. Probably about 1,200 of the 4,200 were brought back. A few have now been impacted by the last 28 days because we did stop operating fitness rooms, weight rooms, for example, and we reduced the level of activity in many programming lines. As we restart programs as part of what was announced yesterday, additional shifts will likely be available as we bring back people to reopen some of our services.
If I could just ask one other quick question around the outdoor ice rinks this winter, with the suggestions from public health officials, to get out and exercise more this year outdoors. Is there going to be any extra resources put to these outdoor rinks? Because they're usually run by volunteers on a few $1,000s. Will there be city employees helping out at these rinks?
Thanks, Pat. Great question. Yes, in fact, we are the basis of the model will still be community driven, with the community grants to communities who want to make ice and maintain ice and even supervise the site. But we're also going to be supplementing that with something called the Rink Ambassador Program, which is something similar to what we did with the Park Ambassador Program last summer, which is essentially a roving crew of staff that will go and assist with maintenance, assist with animation on the outdoor rinks as well, just to encourage greater use and remind people of gathering maximum, social distancing, and all of those things.
Great. Thank you very much.
Thank you very much, Thank you very much, everyone. Merci à tous. This is all the time that we have. C'est tout le temps que nous disposons aujourd'hui. Have a